So welcome everybody, and welcome. And I am so excited to have a very special young lady. We're all young, right? I'm young too. I think I'm my own mind anyway.
Mhm.
And Victoria Rego, and we basically met through the Project Lead program through the National Breast Cancer Coalition. We actually think we were at the same seminar, but if you're not familiar with the National Breast Coalition Project Lead, it's basically an intensive course for advocates who really want to understand the science, to be able to serve on panels and to basically coach other patients in survivor groups, and also eventually to do clinical reviews and be a part of the clinical review board and actually part of clinical trials. So we met there, and unfortunately we're in different teams, which I think is why we didn't really get to know each other, because when you're in Project Lead, I'll let Victoria give her interpretation of it, but they basically lock you in this place for 5 days. It's really fun, but it's very challenging. I mean, we have a lot of homework at night, and it's a lot. It's a lot, and we have a lot of support. But you basically work in a team of 8 to 10 women when you're not attending the seminars. So, what did you think of it, Victoria? What did you think of the experience?
It was definitely intense. It was fun. The food was amazing. Um, but yeah, it was intense. Yeah, no, yeah, I think you're right. Like 8 to 10 women, or I would say people, because there were a few men when I went.
Right.
Um, but it's like going to grad school and cramming a year's worth of work into a week, at least a year's worth of work into 1 week. So I think the days went from like they were like 8 hour days of just continued learning and then go have dinner and then go back do your homework and do your reviews. And yeah, it was pretty intense, but it's definitely worth it. I learned so much during that during Project Lead, and I still use the information that I learn now.
Yeah, I learned a lot too, and I find that obviously they give you the binder with all the information in it, and I've actually gone back and looked back to reference some things that, if I'm involved in something that I don't understand it. But basically, it's an intense cell biology course where you sort of learn how cancer really happens, like what goes wrong in the cell that makes cancer develop. And so anyway, yeah, it was great. It was in a beautiful place in La Jolla,
Yeah.
California, at this beautiful resort. Um, but anyway, it was awesome. I would have wished though that we would have had a little bit more free time to network, because I found that we our team always like ate together, it seemed.
Yeah,
Did your team do that too?
I think so. Yeah, we definitely stuck together. Though I think in a few instances I tried to like just branch out to network just a little bit. But
Yeah.
but yeah.
So I was wondering if you could please start by just telling us a little bit about your cancer story, if you don't mind, and yeah,
Yeah. Yeah.
an emotional thing.
Yeah, today seems to be the day for emotional things, so it's okay. So I was diagnosed in June of 2017, stage 2B triple negative breast cancer. Um, it was a shock, to say the least. There's no known history of any cancer in my family. I have no known mutations at all. Um, my risk factors were very, very low, right? But we're talking triple negative, not hormone positive. So a lot of those risk factors that we know about, they all relate to the hormone positive breast cancers. So they really didn't relate to triple negative, because triple negative is just, they're still trying to figure out what exactly causes it. They know that it's a basal-like cell, but as far as what hormones are expressed or proteins are expressed, they're still learning so much about it. I know that there are different types of triple negative, but still don't know exactly which one I had. Um, but yeah, I mean, I had gone for a mammogram in October of 2016, and that was clear. And one day I was taking a shower and I felt a lump, and um, went to call my doctor and got really busy and sidetracked with life. And then I was taking a shower again, and I was like, oh, wait, you know what? I was supposed to call the doctor about this. And, but we do that, right? Like we always put ourselves last. So I called the doctor, went in, he couldn't feel anything. I had very large breasts. I had to like physically take his hand and put it where I felt the tumor. And he's like, oh, it's probably nothing, but we'll send you for a mammogram and ultrasound just in case. Did that a week later. That turned into, oh, you have not one, but two tumors here. So we have to do a biopsy. They did the biopsy a few days after that. And then 3 days after the biopsy, the doctor who said it was probably nothing was calling me to tell me that he was sorry that I had breast cancer.
Oh my gosh.
And it all kind of like went so fast from there. I went to two different hospitals. The first surgeon that I saw, he really seemed more concerned about saving my breast. Didn't tell me the type of breast cancer that I had. A friend of mine who was an oncology social worker who had previously worked at that facility. She went with me to help me answer questions and ask questions, and I didn't know what to ask, but he was so focused on the vanity part of it, right? So he was just like, you could do surgery first, or you could do chemo first. We'll leave it up to you. And I was like, I know nothing about this. Why is it up to me? I know absolutely no idea what I'm doing here. You're the doctor. You're supposed to be telling me what to do. And went for my second opinion. I actually went on vacation because I was just like had a planned vacation. I was like, I'm not doing this. But before I went on that vacation, I had a second opinion scheduled for the day after I got back.
Now, excuse me, I'm sorry. What made you do the second opinion? Because he was concerned with the vanity aspect, or you just had a feeling?
I had a feeling, I think literally from the time that I felt the lump, I had a feeling that it was cancer. And our interaction just didn't sit right with me. Mm-hmm. And I'm a big advocate of if it's not feeling right, then we're not doing it. Right. And besides, it's cancer. I'm not going to jump to the first person's opinion. So I was fortunate enough to go to MSK, and the surgeon that I saw there gave me a packet about this thick of information, explaining my diagnosis, explaining where the tumors were, explaining what the treatment plan would be. Said absolutely not. You will not be having surgery first. You will do the chemo first. We will shrink the tumor, and we'll do everything to minimize those tumor sizes. And our interaction was it was like night and day. Mm-hmm. And I knew from that moment I was in good hands. And from there, literally within the next week, I was meeting with my oncologist and starting chemo.
Wow.
It happened so fast. I was diagnosed on June 29th. I think I started chemo July 14th.
Yeah. And I think there's one thing we all have in common, no matter what kind of breast cancer we have. We all remember that exact moment when we got the phone call. Mm-hmm. And when you hear that word, you have cancer, like you almost freeze. Like, did you feel that way? Like
I have described it as, so I'm like a big fan of kickboxing, and I was doing kickboxing all before my diagnosis and throughout it. I've always described it as like getting punched in the gut.
Yeah.
It knocks the wind out of you, especially like if you're not expecting it. It just completely knocks the wind out of you. Some of us go into survival mode. We don't even think about what's happening. We just like, what do we need to do? That was me. It was just like, what do we need to do? And let's not worry about it until later. But yeah, it definitely takes you back a few.
Well, you mentioned that, he was concerned with vanity, and I had a sort of a similar experience. They already know about my story, but you know, I remember just having the feeling like, just get this stuff out of here. That, did you feel that way too? It was
Yeah,
like, what you've got to do, these breasts are just, physical things. I just want to live.
basically, I remember telling the doctor, I was just like, your job is not to save my breast. Your job is to save my life.
That's an awesome quote. That is a really awesome quote because, yes, and a lot of women probably don't have the courage to say that.
Right, right.
Yeah.
Um, yeah, which is a shame because we're taught to be quiet and not to, advocate for ourselves. And this is one of the things that like Project Lead came into play, right? Like teaching. I mean, I've always been like a big advocate for myself, but that enhanced my knowledge enough to say, no, this is what we're doing. But throughout all my treatments, though, prior to Project Lead, I was like, no, explain this to me, which is another thing a lot of women don't do. It's just like, because again, we're taught like the doctors know everything, so we're supposed to just listen to them. But it just became so important for me to be like, wait, what is going on? Like explain this to me and explain that to me. And yeah.
Yeah, and it's funny because I think you and I talked about this previously. Like, there's sort of two ways to go with this that I found by talking to other women. One way is, I don't want to know anything, just do your job, doctor, and then I'll be better. That's all I want. And then there's other women like us who are like, well, wait a minute. This is my life on the line here, and I'm going to do my own research, and I'm going to go in there as a patient that I have my own idea of what I want to happen. And so I always say you should treat your doctor as your partner, not as God.
Right.
And we're taught, though, if we're not a doctor, I think we're sort of brainwashed and taught, well, you never question your doctor. God forbid you ever question your doctor. And unfortunately, I met so many women that felt that way and ended up in trouble later.
Yeah.
Yeah.
No, same here. I've met a lot of women like that. And I mean, I've always, it's funny because like I spent so much of my career working in customer service that I got to a point where I'm like, listen, any job that we have is customer service, right? And so the customer is always right. Sorry, one of my cats is trying to like pop in here. And and it's always like that doctor, yes, they went to school, got their education, they know what they're doing, but they are still working for you, right? You are still their patient, but they're also your client. And like you're their client. And that aspect of, if I was hiring somebody to work on my house, I'm going to question what they're doing. Even though I'm not an architect, I'm not a builder, I don't have, the experience in doing that. If you're building a house for me, I'm going to question what you're doing, because I want to make sure that you're doing it how I understand what's happening. And I feel like that's the same thing, how we should look at doctors as well. Like, yes, they're more knowledgeable than us, but if something is not right, then we have that right to ask, like, and explain to them, like, or even just say, educate me,
Mm-hmm.
But you're right, some women don't want to know, and that's fine too. That's what's works for you.
I mean, whatever psychologically you're okay with,
Yeah.
is what you need to do to get through this. And that's why it's called surviving, because you have to figure out, how am I going to come out the other end of this? How am I going to cope with this whole diagnosis that is so overwhelming? So did they ever tell you why so did when you felt the lump, do you have another MRI or another mammogram? Did they find it there, or was it something like
So yeah, so when I had the second once they found the lump and they did did the mammogram. Once they did mammograms, they did MRIs, to see exactly where it was. um I had the tumor in my breast, and then I also had it in my lymph nodes. And they were surprised I didn't feel that one because that one was larger than the one in my breast.
Mm.
But yeah, there was the MRIs, mammograms just to confirm everything, genetic testing because of my age, and then we went straight, we did chemo, and I did neoadjuvant chemo, I did surgery, I did radiation, and then I had to do more chemo after that because, triple negative is one of the most aggressive form of breast cancer, and they don't have targeted drugs, at least at the time. They didn't have targeted drugs for triple negative, right? So they treated it the same way they would treat other breast cancers, right? So I did ACT, right? So Cytoxan, Taxol, and carboplatin in
Wow.
my neoadjuvant therapy. I opted to have the bilateral mastectomy.
Mm.
I opted to not have reconstruction, which that was a whole other story. Regardless of whether I had a lumpectomy or mastectomy, I still had to have radiation because of the lymph node involvement. So we did have the lymph node dissection. And I did not have a complete response to chemo, so I had to do capecitabine after the radiation for 6 months. And that was a whole other experience too. Yeah.
Wow. I mean, and the other thing that you brought up, we are programmed, or we're advised to examine our breasts, but they're not that clear on saying, feel the lymph nodes under your arms. I mean, it seemed like that was something that a lot of people I met did have swelling under their arms, and they didn't even realize that.
But no, you're right. But for me, I didn't think anything of it because years earlier I had swelling under my the opposite side, and it just turned out to be excess fat, right? Like fat tissue. Because I was very large breasted, and so I didn't think anything of it because I just assumed that it was just the same thing on the so.
Okay. Yeah. Yeah.
That's another thing, we shouldn't make assumptions like that either, right?
Yeah, but you know what? Nobody's expecting that diagnosis either.
No, definitely not.
Unfortunately, we've come to a point now where 1 in 8 women are going to experience that diagnosis. And I gave a wedding shower for my now daughter-in-law about 4 years ago, and we were sitting at the table. There were 8 of us at the table having lunch, and my mom was at that table. My mom was the only one at that table who hadn't had breast cancer.
Wow.
And that really gave me pause, because these were all my friends, that were at that particular table, and my future daughter-in-law's mother. So, it's 1 in 8, but it seems that the odds are a little bit, I don't know, it just struck me really. We're all in Rhode Island. Who knows if that's another.
I mean, like I agree with you, right? Because they say that, okay, so 1 in 8 are diagnosed, and then what is it? 1 in 4 become metastatic. And when I was going through treatment, I had, we were in support group, and I had 2 other women. Now, triple negative, again, it's a whole other scenario. Triple negative has a higher rate of metastasis, has a shorter tail on metastasis. But you still don't expect that. There were 3 of us, actually 4 of us in there that were diagnosed triple negative. 2 of us metastasized and passed away. And then that just goes to say though that's the rate of recurrence though, like 50-50, right? Within the first 3 years, it's a 50-50 shot, right? And it's something they don't really tell anybody because they don't want to scare us, but some of us want to know that, right? Because we want to prepare for anything. But it is a little, it takes you back when you realize that.
Well, I have a really dear friend, Tony Turchi, who I have advocated with, and she stopped going to her survivor group. And she became really good friends with two other survivors, and they both passed away.
Yeah.
And she's still in good contact with their families. And, you know, yeah. And I think that's why women maybe are a little reluctant to join these survivor groups,
Mhm.
because you could become attached to these women and knowing that they have the same disease as you. And yeah, it's just a really hard thing. So for people that don't understand triple negative, um, basically, once you finish your chemotherapy and your surgery, and hopefully you have a response, then you're basically left on your own, because
Mhm.
there's no adjuvant therapy like tamoxifen and Femara, which everybody's very familiar with. And so you just pray and wait, basically, and hope that you got it all. And that's so. I mean, I had hormone receptor positive breast cancer, so I can't relate to that. But my friend Tony, I've walked that walk with her, and
Mhm.
and she's now 7 years out. But uh, every little lump and bump, you think, okay, it's the one thing I think that doctors don't get either is what we live with after treatment is completed. We live with this little voice that haunts us that says, I could come back. I could come
Yeah.
back.
Yeah.
And
Absolutely. Absolutely. I have friends that um we would go back and forth because they would complain about having to be on the tamoxifen, right? Or any of the AIs, right? And I get it, I get there are a lot of side effects. And they would be like, oh, but you're so lucky you don't have to take anything else. And I'm like, well, not really, because you at least have that maintenance drug to hold off any, possible metastasis. I was like, I really just cross my fingers,
Mhm.
pray to whoever I pray to, hope for the best and live my life, right? Like, and try to live it in a way that I'm not worrying about. But it's hard. It's hard because yes, you have that, that constant little, like you said, that constant voice is saying like, what is this? And every time something happens, and it's like,
Mhm.
okay, what's going on? Like, or I remember when I was finished with my treatment, I had asked my oncologist, I was like, how do I know when I should be concerned?
Mhm.
And she's like, well, what do you mean? I was like, well, I kickbox. I do this, I do that. Like my bones hurt naturally because I'm very active, right? I was like, so how
Yeah.
do I know that this is just I worked out too much or I should contact you?
Mhm.
Right. And she's like, well, if you are in that much pain and you take meds and nothing is helping and nothing is going away for 2 weeks, she's like, call me immediately.
Mhm.
And it was good to have that communication from her so she could just like, if you get a constant headaches and nothing is helping you, let me know, you know. But she gave me like that, 1 to 2 week window with the headaches. She was just like, if you have a migraine that lasts a few days and nothing is helping, please let me know right away. Um, but there was just other little things, that my communication with her and my asking the questions, so like, how do I know? Like when it helped ease some of that anxiety.
Mhm.
So now I'm like, okay, um, every time something's going on, I kind of try to run a checklist, right? Like,
So, because then that you've thought about everything, right? Right. Yeah.
yeah, I run a check. So like in okay, so we did Project Lead in 2019, July of 2019. December of 2019, I went to San Antonio.
Uh,
When I got off the plane, I had 2 days of where my vision kept blurring. I kept getting dizzy spells. I was having headaches, didn't know what was going on. And my first thought was not that this, I was like, well, there was two things. I was like, if it's something serious, I'm probably in the best place I could be, right? Because there's a bunch of oncologists around me.
right.
I'm like, okay. But my first reaction was, I probably just need new glasses.
Was that it?
It was,
Wow. Okay.
you
Well,
know.
good for you for going down that road,
I was just like, it's probably because I was like, I refuse to go down the rabbit hole with this. I'm going, and my doctor still made me have the MRIs. And I was even telling her it's probably just my vision. She's like, well, I was like, and I was on a lot of drugs that can, interfere with my vision. So it would make sense, right? My vision was already bad long before, long before, my cancer. Um, so that's my thing. I was always going back to like what possible side effects could be triggered, what just other issues, medical issues that I had prior to this that just could be, hey, this is just natural. You're on the computer all the time.
Mhm.
What's going on? But yeah, it can definitely be scary. Yeah.
Well, going back to what you said about your friends complaining when they were on the Famara and everything, I had side effects, but I actually didn't. When it was time for me to get off, I was really upset. Like I was like, this is my security blanket. Like, don't take it away from me. Like, why can't I keep taking it? And the side effect of the Famara is it causes osteopenia, which can lead to osteoporosis. And I was starting to go down that road, but I would have gone anywhere. So I just can't even imagine not having something to hold on to after you've completed the big treatment.
Mhm.
So my heart goes out to you. And one of the things that when I reached out to you, we were going to talk about is the phase 1 clinical trial that I'm involved in with the Cleveland Clinic vaccine. And basically, the vaccine is going to be tested in triple negative breast cancer patients. And
Amazing.
right, the phase 1 trial. And they are just within 3 years, like you were saying, of that critical time period. And what the vaccine targets, going back to, we've all been educated with vaccines now, sadly because of COVID, but if you think of the COVID marker that they've targeted on the virus, the vaccine targets a protein that breast cancer cells are making that they shouldn't be making, and it's called alpha-lactalbumin. And the only reason a woman needs this ever in her life is when she's lactating, if she's nursing a child. And they don't know the reason why that the breast all of a sudden gets this signal, but the result is triple negative breast cancer. So basically what this is going to be in the first phase, it's obviously just safety and dose, but it could be an adjuvant therapy for triple negative breast cancer. And I only can relate to the importance of that, knowing how much that Famara and that tamoxifen meant to me. And I'm just wondering, like, what do you think? If it works, we have to always caveat that we're testing it. If it works, like, how do you think that it, it would be received by women with triple negative breast cancer?
Um, I would like to think, I mean, it's iffy again with everything going on with COVID, right? With the COVID vaccines, but I would think that it would be received well, as a maintenance therapy, as that adjuvant therapy, because we don't have, like you said, that security blanket, right? Um, and if it could help us ease some of our stress, if it can help us get past that 3-year mark, and after 3-year mark, after that 5-year mark, right, when our recurrence rates drop all the way down, then I mean, why not? Why not do it? Because that's 3 to 5 years of, I'm not going to worry so much.
Mhm, mhm.
Yeah.
Well, taking it another step further, which I shouldn't surmise because Dr. Tui would get upset at that, but the hope and the goal is that it would be a cure for triple negative breast cancer. And so I'm just thinking, as someone that's had it, my hope for you and for other women is that if it works and it's safe, then God forbid, let's say you're not a candidate for the vaccine right now
Mhm.
because, right, but anyone who had a recurrence, we're hoping that this could actually be used as a treatment. And it's going to take a long time to figure that out,
Yeah.
unfortunately.
Yeah.
So, matter of fact, the topic came up the other day where we've been fundraising, and after a while, after 10 years of doing fundraising, people start to say, geez, like, why are we still doing this? Like, this guy's never going to get this thing going. Why are there all these delays? And when you hear about warp speed, you like, but it's all a matter of money.
Right.
The sad thing that I've learned by doing this is that researchers can only use that money exactly for whatever it is. Like, this is the trial. So their lab, they have to get support somehow because they're all PhDs. But
Right.
but what a wonderful thing that would be if we could ever say to our kids or to our sisters with triple negative breast cancer, well, if it comes back, we have an option.
Right.
We have an option. And
Right.
and that would be something that would be, I would think, and hopefully someday we'll figure out like what makes this cancer cell do it in the first place.
Right.
The conference I was at last week, there were 6 advocates there, and the question came up at the end where we got to ask questions of the experts, and we said, why does it wake up? We know that we have no evidence of disease. That's what I don't like to call it that I'm a survivor or I'm cured. I don't consider myself cured. I consider myself at this very moment in time, I have no evidence of disease in my body.
Mm-hmm.
Right. But I don't take that for granted. And they couldn't answer that. And I thought, why aren't more researchers looking? And they said, there's no money.
Yeah.
There's
Yeah.
no, they can get money to test drugs. They can get money for looking at the staging, the characteristics.
Oh, you're breaking up.
Um, are we getting ready to run out of time? That's what I'm worried about. I don't have the professional.
Yeah.
Um,
No, I have the no. I have the professional one, so we should be fine.
okay.
Yeah, no, I think the Wi-Fi just kind of went down a little bit,
Okay.
but
Yeah.
yeah.
So I'll repeat that again then. So, they still haven't got a handle on, like, these cells can lay dormant for now. There's a lot of survivors are talking 20, 25 years, and all of a sudden they come back. Why did they survive, and why are they coming back? Obviously, they survived the chemo,
Right.
which is a problem because they can't use the same chemo again.
Mm-hmm.
But there is money now through NIH with the Prevent program that they're starting to look at it. But to me, like, you should know why something happens if you're a scientist.
Right.
Like, it's not only the what, which is the cancer, it's the why.
Right. And that's the most important thing, is the why, because I mean, and I know we spoke about this previously, that like for me, unless you actually know what the root cause is, you're really just kind of putting a band-aid on it, right? So yes, there's I hate the word cure because we have that situation, right? Like you say, you're cured. I know for me, like when people say like, well, how are you now? What did they say? And I'm like, well, they tell me that I'm cancer free, but they also don't do any tests to prove that to me. So I, got to kind of take their word for it. But yeah, we're just putting like that. You have to know the cause of it. Of anything, any issue, we have to know what the cause is. Yeah.
Right.
So.
Yeah, and I think that the doctors talked about earlier, they don't get it that when you're going through treatment, first of all, like you described, you're so involved in the process that the energy, it's like your adrenaline is running. And then they say, you're done. And, I had the adjuvant therapy, but still, you're like, all of a sudden, I was like, I don't want to really be done because you watch me, you check me all the time. I want to come back and see you. I still want to keep the schedule. And I think that the psychological part of that, we talked a lot about that at this last conference, that there needs to be more support for women at the end of treatment.
Absolutely.
Yeah, because psychological is not being addressed. The physical is being addressed, but not the psychological. And
Right.
and you've become an advocate. So let's tell us about that. You've been helping.
I've become an advocate through Project Lead, but more so on a personal level, I do my best to educate other women about breast cancer and the different types of breast cancer. And more importantly, to understand that they need to know their bodies, right? I have a daughter, she's 20, she was just turned, she was 15 when I was diagnosed. She turned 16 while I was in treatment. And it didn't quite hit her until recently, where she was at school, and they were doing a fundraisers for Breast Cancer Awareness Month, and there was a table. And she's like, wait, I didn't realize that because you had breast cancer, that increases my risk. And I was like, well, I know I've told you this, but it didn't click until she heard it from somebody else.
Right.
And so like for me, my form of advocacy is know your body. I'll use my social media and I'm like, know your body, know what it feels like, whether male or female, know your body. I've done talks like this. I've done talks for other podcast and groups. My friend who one of my friends who passed away, her husband started a group for men on Facebook, and he asked me to come speak to them about it as well, from like the aspect of not really understanding what you need, right? So for me, it's more about the education. But yeah, I'm definitely, making those phone calls as well to our representatives. And I would love to get more involved with the research with the DoD, and like even now.
Did you also answer a phone?
So what I was doing was I was working for a breast cancer support service, and I was their helpline manager.
Okay.
So I was training the volunteers, I was answering phone calls and educating the callers during that time as well. And helping women understand their diagnosis and teaching again how to be an advocate for themselves. It has always and will always amaze me how little some doctors will share, especially in rural areas, or based on color or nationality, or accent. And I remember like when I was doing that role, it was a constant like, well, I have breast cancer. I'm like, okay, but what do you mean you have breast cancer? Tell me more. What kind of breast cancer? I'm like, well, I don't know. They just had breast cancer. As a matter of fact, I have this conversation with somebody today that I work with, and they're like, her grandmother was recently diagnosed with breast cancer. And I was like, well, what type of breast cancer? She was like, I don't know. I was like, well, what is she on? Like, what therapy is she on? And, she started telling me, and I was like, oh, so she probably has HER2 positive. She's like, how did you know that? Just by knowing what therapy it was, what treatment it was. It's like, yeah, trained, studied, thank you, Project Lead. Thank you to my old job as well, because that was part of my job, is to know, exactly what treatments went along with each specific type of breast cancer. And so every time I hear somebody is diagnosed, there is that whole education, and let's talk about it, and let's give you the knowledge that you need in order to take care of you, and ask the questions that you want to ask.
Yeah, and I also found when I was diagnosed too, unless you kind of do some research on your own, they only tell you a little bit at a time. It's almost like they just say, well, we're going to do this and get to this point, and then we'll evaluate. But and unless you ask a lot of questions, sometimes they just don't. And unfortunately, it's women of color that have the highest risk of triple negative breast cancer, particularly African American women and Latino women. And you and I had a fascinating conversation about that the other day, that I still have to look up that study, because I was like, whoa, that's really kind of mind-blowing,
Right.
But yeah,
And you know what, me being part Cuban, I fall into that category. So
yeah, and I just think that the more genetics that we understand, the more that we can, because there's so many families that have many, many cases of breast cancer, and they're not BRCA1, BRCA2, they're not, any of the known things that we know of at the moment. So, and environmental is tough to narrow down, because there's so many factors to that: your diet, your lifestyle, where you live, all kinds of things. And it's really, really a puzzle. It's a big puzzle. But well, gosh, first of all, thank you for accepting my invitation, which was so gracious of you to do that. And I'll put this out on both my podcast and on YouTube. But is there anything that we didn't talk about that you'd like to talk about?
No, I mean, just I don't think there's anything we haven't really covered, like I said, I mean, I'm very into, women, everybody knowing what their body feels like, so they know when something is wrong, and trusting when something doesn't feel right, and speaking up if you're not comfortable with what your doctor is saying. Your doctor might have gone to med school, but they don't know your body like you do.
Right.
That's something that we need to keep in mind. And support is tricky. There's some women that are so independent that they don't know how to ask for help. So you ask for help when you need it. Ask questions. It's like that's the best thing that we can do, is just ask questions.
Yeah, and my husband and I are actually in process of making a presentation about the co-survivor, the person that you take with you to your appointments, that writes things down, because you think you are hearing what you're hearing, and I found it was too distracting for me to try to write things down, because I was trying to absorb and ask questions. And secondly, you said about women, people will call and they say, what can I do? What can I do? And you're like, well, it's hard to say, well, gee, I need my laundry done, or gee, I need shopping.
Yeah, absolutely.
Right. It's like, we're women, we think like, I can do it, but you can't do it. And I think I just got a suggestion from someone, for someone that is helping you get through your treatment plan. Just have a list of things, and if somebody calls, say, well, hey, we need dinner on Tuesday night, and gee, we really could, so when they call, you have something ready, concrete, and say, and if they really want to help, they'll do that.
Right. Exactly. There's always that, you use a calendar, make a list. The other thing that I want to make a point of is that, because some women don't have somebody to go with, record the conversation.
That's an excellent point. Right.
Right. we all have, on our smartphones, we all have a voice recorder. It's right there. Utilize it to your benefit. There are apps out there that will help you manage your treatment, and give you the opportunity to list your side effects. One of the things that I used to do during treatment, and even like for my follow-ups, is I would make a list of questions and email them to my doctor before
Oh,
my appointment.
great
And
idea.
they would always print them out
Hmm.
and have them right there with me, and we would go over them.
Excellent idea. Right.
So
Right.
because we often think of the questions afterwards,
Hmm.
so just make a list. I had a running Word document of questions, and I would send it, and then I would like, okay, I got the answers here, here, and here, and then I could start a new list, and those would go. And yeah, there's always ways to, especially now that with all the technology that we have, but record the phone conversations, even if you have somebody there,
Hmm.
because that person might also be in shock and miss something.
Yeah, that's true. Yeah, that's
Record
true.
the phone conversations, because you don't know what's gonna, like we don't unfortunately always know what's gonna happen when we go to that appointment.
Hmm.
Um, hopefully, you won't have situations where, like I had, where I went going thinking that I was having treatment, and because I had a fall a few days earlier, they're like, well, you're not having treatment, you're going to go have an MRI because we don't know why you fell. And,
Hmm.
and by the time I was done with everything, even though I was technically okay to do treatment, it was so late in the day, they're like, we're skipping this week.
Right.
So you don't know, like there's so many things that come into play, like during those appointment times. And so it's always good to have a recorder, to have somebody there with you. Bring snacks.
I love the recorder thing. And I also love the fact that you emailed your doctor in advance so that
Yeah.
he knew, like, because we all know they're on a time schedule, right?
Mhm.
But I think if they know in advance, what you need from them, that they will, be prepared, um,
Right.
and do that too. And I also found the nurse practitioners just amazing. And
Amazing. Amazing.
yeah.
The other thing that want to say is that life doesn't necessarily have to stop, right?
Hmm.
Um, when I was diagnosed, long before I was diagnosed, I had planned a trip for my daughter's sweet 16.
Hmm.
I made it a point to tell my doctor that this trip was happening. Like it or not, this trip was happening, you
Right.
know?
Right.
And so we did that, and they made it happen. You
Yeah.
know,
Yeah.
had to go through blood tests before that, but we made it happen.
Right. Yeah. But I think once you've had cancer, and I'm 12 years out now, and I forget this myself a lot, is that you're like, my old principal, I worked in a Catholic school, she would say, be present in the present. Like, live, enjoy your family, live, nobody knows what the next day is going to be. Nobody knows if how many days we have. It's not promised. But
Right.
so the last thing that we can kind of finish off with is, and I think you've already covered this really, really incredibly, but like advice to someone who's newly diagnosed.
Um, breathe. Um,
Yeah, that's hard. That's
breathe,
hard. That's hard to
breathe.
do.
That's the hardest thing to do, right? My advice to somebody who is diagnosed is to ask for help.
Hmm.
Um, trust your gut. If you meet a doctor and it doesn't feel right, go get another opinion. Even if it does feel right,
Hmm.
always go for a second opinion, right? Like, no matter what, always go for a second opinion, because it only benefits you, right? It confirms everything. If it might give you, like in my case, it gave me more information. um, and speak up. Don't be afraid to speak up. Ask for information. Let the doctors know if you. That's a big thing. A lot of, and I had a bad habit of not always saying how bad the side effects were.
Mhm.
right? Again, trained to be quiet, right?
Right.
Just kind of sit and suffer. Let your doctors know if you're having side effects. Be verbal about it, so just be verbal, period. Like, like let them know you want to know what's going on, and make that list of questions, have that recorder, have somebody, if you can have somebody go with you. And the reason why I keep saying if is because family wise, I didn't have anybody that will go with me. I had friends, I had friends who came with me. I had, friends from my gym that came with me, so not everybody has that community. Right? and and it's okay. Like, you don't have to be alone, because you build, I mean, nobody wants to have breast cancer or any kind of cancer, but the community that is built within that sisterhood is amazing.
Mhm.
So ask for help. Don't be that one person, and I'm saying this because this is who I was. I didn't need support group. I didn't want to be bothered with support group. And I went to support group and I realized, hey, maybe I do actually need this, you know? Um, and it's good. Yeah. But definitely speak up if you need to.
Okay. Well, now we're friends, so we'll be
Yes.
talking again. And
Yes.
thank you so much.
No
And
problem.
if I can ever help with anything or, be of support, I'd be more than happy to. But I really appreciate you, accepting my invitation to reach out. And I'm sure everyone that watches this is going to be very grateful too. So good night and good health. And thanks so much, Victoria.
You too. Thank you. Have a wonderful night.
You
Bye.
too, honey. Bye-bye.